Hey, Cherry Creek Medical Class, Stirrup here. I got Dr. Kathy Benson to talk to you, and she's animal vet, so you're gonna hear some great stuff. Kathy, thanks so much for joining us today.
Oh, thank you for having me. Hope you guys are ready for this virtually, so we'll do the best we can. So my name is Kathy Benson. I'm a parent of two Cherry Creek High School kids, one of whom took this very same class last year, and I'm happy to present about veterinary medicine. So a little bit about me. I went to high school in California and really wanted to move out of state. Boulder looked attractive, so I majored in biology there. And it took me a couple years actually working for a botanist to figure out that I wanted to work with animals. And then I ended up going to Colorado State University for my Doctor of Veterinary Medicine degree. And I've been doing this for about, let's see, a little over 20 years now, and I'm a co-owner of Companion Animal Veterinary Hospital here in Centennial. So, a little bit about my career. It is very varied. I wanted to start the presentation with this picture of me wearing my t-shirt. I'm going to read it to you because it's a little hard to see, but basically it says, it just kind of embodies what being a veterinarian is. It says, I'm a surgeon, cardiologist, radiologist, oncologist, dermatologist, ophthalmologist, pathologist, dentist, neurologist, anesthesiologist, orthopedist, behaviorist, internist, and parasitologist. But you can just call me veterinarian, which is really very true. We do almost all of these things and almost all of these things daily, just different things every day. So a lot of what I do is preventive medicine, and that is wellness care. It's very important. Making sure animals are healthy, finding hidden problems their owners may not have known about, um, counseling them on weight. A lot of pets are overweight, and that's a big health problem. So giving them vaccines, running blood work, and tips on training, nuisance behaviors, and things like that. So that's a pretty big part of most of my days. We do run a lot of testing to see what's wrong with animals, or maybe just to make sure that they're doing all right, or maybe make sure that their medications are working well. So those diagnostic things involve looking under the microscope, like we're doing here, looking at some cells. Those are red blood cells. Running blood work, we get printouts that look like this, tell us about chemistries in the bodies and blood cell counts, and we can see this guy's got quite a few red flags, so something's going on with him. We look at urine. This is part of doing tests for urine. And then also a lot of imaging. So down here, imaging means x-rays, radiology, MRIs, things like that. So a little bit about imaging. X-rays are pretty standard. Radiographs, most practices have those. Nowadays, they're mostly digital, so quite easy to just snap a picture. Also very easy to send to specialists. So we do that routinely. We send all of our x-rays out to a radiologist, which is really good for not having to be a specialist in all of those areas that were on the back of my t-shirt there. So this is a picture of an x-ray of an abdomen of a dog that has eaten a rock. So sometimes imaging is pretty obvious. It gives us the answer right away. They ate a rock, they have a fracture. Sometimes it's a lot more subtle. Sometimes you can't tell what you need from an x-ray, so you need to go one step further with imaging, and that would be something like ultrasound. Ultrasound, a lot of regular practitioner veterinarians that are interested will do their own ultrasounds. A lot of them will have a specialist that does ultrasounds and travels to different clinics, come out to their hospital and do ultrasounds that way. MRI and CT scans, those are not something a general practitioner would have the ability to do or the equipment to do, but is definitely something that we use a lot in veterinary medicine. It's just something that would be done at a referral hospital. Case in point might be a back injury where they've slipped a disc and they're paralyzed in the back end and they need a specialty surgery to get that disc out of there. And you can only see which disc it is with an MRI or a CT scan. So those we would refer to a specialized hospital. And as you can see from that last x-ray, a lot of our imaging leads to surgery, and that's a really big part of veterinary medicine that I really like. Here are some pictures of my business partner, Dr. Munger, doing a foreign body surgery with one of our assistants, Hannah, and it looks like they are pulling out just some nasty stuff out of stomach or intestine. I can't quite tell there, but foreign body is a really big, very common surgery. Animals are always eating things that they shouldn't. Here's a gastric foreign body surgery that I did kind of recently. This is Bentley. He's a 20-pound Cavalier King Charles Spaniel, real cute. He had been vomiting, just not eating well. Owners really didn't know what was wrong with him. At first, didn't know anything he could have gotten into, but he was really painful on his abdominal palpation. We did do x-rays on this guy, and they weren't really exciting except for the fact that there was just something in his stomach, and I had to question her a bunch of times about eating, and she said, no, he really has not been eating. Finally, her teenage daughter remembered that he had gotten into the bathroom trash about a week ago, which turned out to be a very significant incident for him. So I went ahead and did a surgery called an enterotomy, and that means incision into the stomach. And here's a little bit about that. This is a video of starting the surgery. So as you can see, everything's all gowned and toweled in sterilely, just like it would be in human medicine. That's me making an incision into the stomach. You can hear all that beeping and noise. Those are our monitors, keeping the patient safe. And of course, the radio in the background, that's always important when you're doing surgery. Okay, so that was getting into the stomach, the enterotomy. And then here we go. Here I am taking out whatever's in there.
Aha. There it is. Whatever it is.
So remember, this little guy only weighs 20 pounds. There it is.
I think it is what we thought it was, possibly. A tampon, possibly.
So remember, he got in the bathroom trash, so that's where he got that.
Okay.
So there that was. And then sewing up, we use needle holders and forceps. And basically, it's just like sewing. Here we are tying a knot. And we're just getting him all closed up. And just like that. So that gives you a little taste of foreign body surgeries, which we do a lot of. Veterinary medicine has many varied surgeries, so you're not going to be doing just one type. This is a very different type of surgery. It's called a pyometra, which means infected uterus. And this is an intact female dog. These are her female parts, and she was very, very sick, leaking pus, as you can see. So that's a pretty big emergency. Got to get it out of there before it ruptures or they become even sicker. So here I am doing basically a stressful spay surgery. So it's just like a spay, only at the point in time where the dog is much older and uterus is infected. And this actually is a dog uterus right here. It looks very different than human anatomy. And that's just because they're going to have lots of puppies, not just one or two babies. So they have very small puppies, and they'll grow in here, little round vesicles in each horn is what these are called. So it's just a uterus that's designed for having multiple births. Another real common surgery is splenic tumors. This is the spleen of a dog who developed this large mass, very common in certain large breed dogs. These are very dangerous because they break open and bleed into the abdomen and can cause sudden collapse, sudden death. Animals and people as well can live without their spleen. So the treatment for that kind of cancer is just to take it out. So there it is. I really like surgery. It's always very interesting and usually pretty gnarly stuff in there. So you kind of have to like gross things if you're going to be in veterinary medicine. Orthopedic surgery is a whole nother category of surgery. So this little guy had a surgery on his knee. This is Dr. Careyhart, and he has an interesting veterinary job. He is a traveling surgeon, so he takes on bigger procedures that maybe a lot of general practitioners don't really want to do, maybe don't have the equipment to do. In this case, he's doing a knee surgery right here that involves this special plate. It's actually a patented surgery, so you have to go to special class for it. And the equipment is very, very specialized, and it's used to stabilize knees after a dog has torn a cruciate ligament. So that's a really interesting profession in veterinary medicine, is to go out and specialize in something, just like Dr. Careyhart specializes in surgery. And here's a little video of him doing his surgery. I think it's pretty gnarly. It's just a little hard to watch. He's sawing a bone, so if you want to look away, now's the time. Oops, maybe that one didn't play. Well, anyway, the point to keep in mind about that is that you can be a specialist in a lot of different areas of veterinary medicine, so good to keep in mind. Besides surgery, we do a lot of emergencies, so sometimes things will come in that are trauma-related type of things. That could be maybe dog bite wounds, got in a fight with another dog. That's what happened to Nellie right here, and had to do a surgery to put these drain tubes in. They look a little Frankensteinish, but they are there to prevent infection. Once they get puncture wounds all over, they're very likely to grow bacteria under the skin. And with these drain tubes in place, they stay in place for about 3 to 5 days. It allows all that infection to come out of the tube or out from around the tube and not build up a big pus pocket in there. So that's what happened to Nellie. Lacerations, like a cut paw, very, very common emergency medicine presentation. HBC is a hit by car. One of my favorites, robo, run over by owner. Don't see those very often. Snake bite. We also have things that are not quite such physical emergencies, that are such an obvious trauma, but managing medical problems like a diabetic crisis. Maybe an animal got too much insulin or didn't eat enough for their insulin to act on. A diabetic animal could come in crashing. Severe vomiting or diarrhea is a common medical emergency. Other things that are surgical, bloat. That is when the stomach will fill up with gas and actually flip and rotate. Let's see. Can't get rid of this bar here. Bleeding, the bleeding tumor, like we talked about, another emergency. There's a picture of a good laceration for you. So like I said, you kind of have to like gross in veterinary medicine. If you really don't, it may not be the career for you, but if you like gross, it is just awesome what we get to see on a daily basis. Some medical emergencies are a little more subtle. This is an allergic reaction. If you look at this little girl, it's kind of subtle, but you can see she's really swollen over here. Her eyelid's kind of puffy. Her muzzle is really big. Classic insect sting, so probably bit a wasp or something like that, and that is treated medically with injections of Benadryl and steroids, which you see over here. Toxins, a lot of times dogs get into chocolate, things like that. Heat stroke, another common emergency. Here we go with a toxin ingestion. This is actually the best smelling vomit I have ever smelled. It smelled just like chocolate, but looked pretty gross. So not only is veterinary medicine gross, but it's also not very glamorous. So you can kind of see it's just all over the place, big mess. The reason she's wearing this cone around her head is that the way that we make them vomit is we put this little dissolvable tablet right down into the sac of their eyeball. They have that third eyelid. If you've ever seen that weird membrane on dogs' eyes, that's a third eyelid. So we put it between that eyelid and their outside eyelid. And this pill will dissolve. It's called apomorphine, and it makes them vomit. We put the cone on because it's kind of irritating. They usually try to scratch it out of their eye, so they have to wear the cone. And then when they're all done vomiting, we get up the maybe sock that they ate or the toxin that was ingested. Then we can just rinse it out of the eye very simply, and they stop vomiting and they go home. Oh, here's another good gross thing for you.
Her pants. Okay.
A little dermatology. It's just a cyst.
Okay, this is a gross cyst. Oh, awesome. Yes.
So you can hear
Sweet. Oh, that was everything I wanted.
you can hear all my staff members whispering. They love the gross too.
Disgusting. How fun.
Oh, yeah.
Oh, yeah.
That's a good one. Jeez. That's gross.
Okay, so like I said, everybody at my office enjoys the
Her
gross.
pants. Okay.
Okay. Internal medicine cases. So this is a very big part of what we do as well, getting away from all that surgical stuff. This would be things like organ dysfunction. So kidney failure is a really, really common thing, especially with cats. That's what this guy has going on. His paw is bandaged just because he has a catheter, a little port in his veins. That's what this tubing right here is. It's hooked up to eye fluids, trying to the toxins from his kidneys. Endocrine
It doesn't look
problems.
like your video's playing on my end.
Oh, did it? It's over now. Did
Oh,
it not play before?
I don't think it did.
Oh, that's too bad.
We heard people talking, but it didn't
Oh,
have the video itself.
huh.
I don't know.
Yeah.
But are you on a different slide now? Because the slide
Yeah.
hasn't advanced either.
Okay. Yeah, I'm on a different slide. Oops, go back. How about if I get here? You see anything?
Still on the, it looks like the two hands holding the big clump of fur.
Really?
Yeah.
Hmm.
I'm going to hit pause on.
Okay.
Okay.
Okay. Hi, guys. We're back. Sorry about that. Our last video was gross and awesome, so I'm sorry that you missed it. But we're trying to talk about internal medicine cases. So things like organ dysfunction, kidney failure being the most common, especially among cats. That's what this guy has going on. He is in a kennel and he's hooked up to this IV line you can kind of see right here. It's bandaged into his leg. It's basically a port into his vein, giving him fluids, trying to flush out the toxins that his kidneys are not doing such a good job of flushing out. So that's a common thing that we would do in veterinary medicine. Treating endocrine problems. So the endocrine system would be like your hormones. You would be maybe diabetic, lack of insulin, hyper or hypothyroid problems. Do a lot of that. Infectious diseases. So parvovirus for puppies, leptovirus, which humans can get as well. Bacterial diseases, they get sick just like we do. And then cancer is kind of a biggie. We do a lot of cancer surgeries, removing lumps, sometimes amputations for bone cancers. Sometimes it's just medically managing cancers with chemotherapy. Some general practitioners will do a little bit of chemotherapy. A lot of us just refer to referral practices and they can do chemotherapy there. Internal medicine is a very big specialty. So we were talking about Dr. Carrie Hart is a surgical specialist that we use at my hospital. Internal medicine is a big specialty. And then really any branch of veterinary medicine can be a specialty, ophthalmology, dermatology, any of those. We also see just a variety of random other types of cases in veterinary medicine. Eye problems, so this guy has pannus, condition where plaque-like substances and blood vessels will abnormally grow across the cornea, causing difficulty with vision, really common at altitude and in sunlight and in certain breeds. So if you're...
Didn't advance your slide for some reason.
Uh-oh. Let me ask Jim if he can help out. Okay.
So we're going a little bit backwards, folks, and but you didn't want to miss this video.
Okay. Sorry about technical difficulties, but this is pretty gross and awesome,
Okay,
which
this
to
is
me are the same thing.
cyst. Oh, awesome. Yes. Sweet. Oh, that was everything I wanted. That feels better, doesn't it? And we have this open hole. It's disgusting. Okay.
So you can hear my whole
How
staff
fun.
oohing and eyeing. They
Yeah.
just love the gross too.
Jeez. That's gross.
Okay, let's try to get to our
Okay,
next
okay.
slide, which would be, okay, wait, maybe here's where the difficulty is.
Reduce your screen. Exit full screen. There you
Okay,
go. And then if you click on number 21 slide,
there we go.
and then
Okay, go in there. Okay, and you can see that guy. He's
we
just
see,
not very big.
we see the cat, yeah. And then if you go to present,
Okay,
and see if that works when we go to the next screen. Because
okay.
you talked about this guy.
You got that guy already?
Uh-huh.
Okay, you got eyes already?
Oh,
And other cases?
that's where we need it. Now we're on eyes.
Okay, well, it was other cases. We talked about this variety of other cases. Ophthalmology, we see a lot of that. This guy has basically a plaque of substance and blood vessels growing across his eye, really common at altitude and in sunlight. We see a lot of derm cases, so that would be usually your ear infections, skin issues, kind of like that cyst in the last video. Heart and lung problems, animals go into congestive heart failure, just like people. They don't get so many lung cancers because they don't smoke, but they do have allergies and parasites that can infest their lungs, pneumonias, things like that. Lameness, that's a big thing that we see. Limping dog, something wrong maybe with a shoulder or a knee. Parasitology, fleas and ticks, don't see a whole lot of those at my practice, just not a lot of fleas in Colorado, but parasites that burrow under your skin, lice that live on the skin, internal parasites in the stomach and intestines, hookworms, tapeworms, things like that. We deal with that on a daily basis. Neurology, animals whose maybe spinal cord or peripheral nerves are not working properly, tumors in the brain, disc problems in their back, and cancer, lumps and bumps, lymphoma, which is a type of blood cell cancer, and then internal tumors, like that big spleen tumor that we talked about. So all of these, like within a week, I probably do all of this stuff. So it's really never boring. Can never really plan for it entirely, but that's part of the excitement. Here is a little dermatology case, just looks like a foot that's very inflamed. Dog has been licking at it, really uncomfortable, won't put weight on it. Turned out to be something super simple. Here is the culprit. It's just a foreign body, which just means something that's stuck in your skin. And this happens to be a little grass seed. It's called a grass awn, and there it is. That happens commonly in the late summer, early fall. Parasites. Okay, here's another video. Mr. Stirrup will tell me if it doesn't work. This one is very gross, much more awesome than the last one.
Can't wait.
Yep. Okay, so this is called a cuterebra. It's a bot fly larva that flies lay their little eggs and they burrow under the skin. And
Well, we're just watching him.
then you got this little parasite breathing under the skin.
Okay.
Very itchy. We have to get them out.
Okay. Let's see if your friend wants to come out of there.
Oh.
Okay, buddy.
Dr. Benson, you win this year. You got the grossness factor.
Oh yeah, it's like Dr. Pimple Popper, but better. Here you come.
Oh.
It's bigger than I thought.
Oh.
Awesome.
Okay, that is my favorite thing. It's a summertime thing. So we only see those in the summer. I'm sad that they're gone. This is Smarty. Eyeballs popping out. Like I said, you have to like the gross or you're not going to like this career at all. So that actually happened. You might think that this guy is another eyeball case, but that is not actually true. What he has going on here is a really, really bad tooth root abscess, which brings us to this huge facet in veterinary medicine, which is veterinary dentistry. Um, I probably do a dental cleaning, which is really much more than that. I probably do one. We probably have one at our practice at least every weekday, so Monday through Friday. So this is kind of one of the worst of the worst. This is tartar. This is like pus. This is hair. This is just gross. So this guy really needs his teeth cleaned. We tried that. So this is Toby before. We cleaned them all up beautifully. We have an ultrasonic scaler. The nurses do that. They clean the
Whoops.
teeth.
Looks like you need to go to. We just have we have the dog with the eye popped out, Smarty.
Oh dear. Let's go small. Oh, what am I doing here?
The kids are gonna have a riot going through this. They're gonna be like, well, "This is funny."
Oh, I just wish that I don't know how to make it work. Let's see here. So you're on this slide. Let me push exit and see what happens.
Okay.
Is that okay? And then we'll advance it. So you got that?
Nope,
Okay.
we're still on the protruding
Oh.
eyeball.
Okay, what if I, oh no.
Stop sharing.
Uh-oh. I hit share, but oh my goodness. You're not recording now, are you? Or can you like edit later?
There we go. You're good.
Okay. Sorry for technical difficulties. I have to say, veterinarians are just the worst at technical difficulties. So
you're doing perfect. I have a radiologist. None of his videos worked, and so fortunately I knew where he had saved them. So his video sits there, and then there's all the videos of what he has that come in after.
Well, anyway, so that moves us to this huge facet of veterinary medicine, which is veterinary dentistry. And this guy's mouth is like one of the worst of the worst. So we've got tartar. This looks really loose. It's about to fall out. This is pus. This is hair. Just nasty. So this poor Toby, we always take pictures of the teeth before and after we clean them. But unfortunately for poor Toby, cleaning wasn't enough. We always take x-rays as well. And these are x-rays of little teeth. And as you can see, well, this white stuff down here is bone that the tooth should be in. It's the socket. And really all of this bone should be right up here. So he has lost a ton of bone, which means these teeth are not healthy. They're not going to stay in place. They're just going to get nasty and infected again. So this is what we had to do to poor Toby, is just extract all the teeth. So veterinary dentistry is a lot about cleaning teeth, but it's also a lot about extractions. These were pretty easy because a lot of the bone was gone. Sometimes they're a lot more difficult. It takes a lot of really careful surgery to drill that bone out and get those teeth out of there. Sometimes dental problems are a lot more subtle. This is a cat. His teeth at first glance look pretty normal. But if you look down here, there's this little red lesion on the tooth. It's called a resorptive lesion. It's a really painful autoimmune condition by which their body basically attacks the junction of the crown and the root and erodes the tooth away. It's super subtle, but it's really, really painful. So it's good to pick up on these. And then the treatment is just extraction. So we do a lot of that in veterinary medicine. Here you can meet Bodie. Bodie lives next door to me, and he's constantly getting tan bark. As you can see with the circle, that little brown thing is a piece of tan bark stuck between those two teeth. And I've pulled it out a couple times. His owner has pulled it out a couple times. This time it just wasn't coming out. And I said, he really needs a dental cleaning and we need to do something with these teeth back here. So we got an x-ray of that area. And after we got the bark out, you can see this huge pocket here. This white bone should be, it's up here. It's filling in right here. And it really should be a straight line across here. It's missing. And that's because the bark kept getting stuck in there and it's just not really a healthy tooth root anymore. So we extracted that tooth, and Bodie, I'm happy to say, has not gotten any more bark stuck in his teeth. So extraction we do all the time. Root canals can be done in veterinary medicine, not very often. Metal capping, that can be done, like maybe a big important tooth like a canine tooth that is broken and you don't want to extract it, you just want to cap it. Usually those are referred out to yet another specialty, veterinary dentistry. You can become a veterinary dentist. Believe it or not, there's even orthodontics in veterinary medicine. It's not for cosmetic reasons, it's for functional reasons. Maybe their lower sharp canine teeth are coming in a little too narrow and they're pointing straight up at the roof of the mouth, makes it hard to close your mouth. It's painful, they can't chew well. Those sorts of things you could refer to a veterinary dentist. They could put a little appliance in there and move those teeth out so there's not a painful problem. Very popular specialty. I'll touch a little bit on large animal, equine, and food animal medicine. This is not something that I do, but it's just a totally different facet of veterinary medicine. What I do is called small animal medicine or companion animal medicine. So dogs and cats is primarily what I do. These are pictures from a former employee of mine who went to veterinary school. She's at Oregon State right now. Large animal refers to cattle, horses, sheep, goats, pigs, and the like. Food animal, there's kind of an overlap in there except with the horses. So food animals would just be cattle, sheep, goats, pigs. Veterinarians might call themselves, a completely large animal doctor, and they do everything. They may be only cattle, that's all they do. They maybe do cattle and horses. You could kind of pick and choose what you want to do, so you don't have to do all of these species. It's really a lot to learn. Equine alone, that's very popular as well. Sometimes they will do that in combination with some of the larger animals, or even small. There are clinics that will do equine and companion animals, so horses and dogs and cats. This is my former employee, Janelle. This is her friend, and I think I mentioned before, veterinary medicine is not glamorous, so if you look really closely, yes, her arm really is up this horse's rear end. So what she's doing is palpating, and that just means feeling through the horse's colon. You might be feeling for like a fecal impaction or something that's stuck there, or you're pressing down on the colon to feel the uterus and find out if she is pregnant or open. So breeding management is a big deal in large animal and equine medicine. Here they've gotten a little fancier. This young veterinary student actually has a probe that is connected to an ultrasound machine, and they're looking. So my guess is she probably is pregnant, and they're looking at the fetus in there. Pretty interesting stuff. Here are some of Janelle's equine pictures. So this is a horse going into surgery, and everything's just much bigger. These are the tubes connecting to the anesthesia machine, which I had in some of my surgery pictures, but it's just much, much bigger. Colic surgery is something that an equine veterinarian might do. Colic is impactions, things that aren't going through the gastrointestinal tract correctly. Sometimes they have to be surgically removed. Foal delivery and care. This is a little guy. That's a foal. Looks pretty big, but they're actually born at about 100 pounds, so pretty big animals. Lameness is huge as you can imagine, with the horses. If the horse can't walk right, they're not too useful. And they also, they can't really survive. They just almost never lay down. So lameness is a big deal. Breeding soundness, that means, how economics in large animal and equine medicine is a big deal. You're not going to get the money if you can't breed horses. So making sure that they're breeding properly. Pregnancy check, we saw that with the arm up the rear end and the ultrasound up the rear end. Teeth, that's a big deal. Not the same that we do in small animal medicine, but their teeth in horses are continually growing. So sometimes, especially when they get older and they're not chewing as well, their teeth get too long and it causes problems. So you have to file their teeth. It's called floating the teeth. Endocrine is a big deal with horses. They get Cushing's disease, which is an adrenal gland problem, problems with their organs as well, things like that. So that's something that equine medicine might do. Here's some interesting animals. It looks like a llama or maybe even an alpaca. I'm a veterinarian and I'm not quite sure I know the difference, but that would be kind of go under food animal, even if you don't plan to eat your pet. Alpaca is still a food animal type of species. And then that is a sheep. Another facet would be your wildlife animal veterinarians. There's also exotic animal veterinarians. There's one right up the street from me, Dr. Labonde. He practices at Homestead Animal. So he does birds and exotics. So birds would be, your pet birds, or maybe your falcons and hawks and things like that for avian medicine. Reptile medicine. These photos are all courtesy of Dr. Labonde. I thought they were super cool. Pocket pets. This little hedgehog, rabbits, little sugar gliders, kangaroo. I asked Dr. Labonde about this. He said it actually is a pet and not a recommended pet at that, but truly, truly exotic. So there's so many things you can do in veterinary medicine. Poultry medicine, that's more, economic than really about the one animal, the one chicken. It's more managing flocks so that basically we can, feed our country. Chicken and eggs are really a main food source, so really, really important. People nowadays are getting into their backyard chicken flocks, so that's another area of poultry medicine. This guy actually sees Dr. Labonde every few months. He has a neuromuscular condition. He's a pet, and he said he's actually quite happy in his little wheelchair cart there. Oh, these pictures are from a friend of mine that I went to vet school with, who is a Army veterinarian. And I just wanted to show you some of her slides because that's a very interesting career path. And in fact, you could, if you did it right, go into the Army first and get them to pay for some of your veterinary medical training. She did it the other way around. But anyway, super interesting. I love talking to her. Her life is just like crazy exciting. But what she does is care for a lot of the working dogs and horses, care for military pets on base. So usually when she's stateside, that's what she does. It's a little more tame. Food inspection is huge for the military. They have to keep, especially when they're on deployment, they need to keep their food that's going to their troops safe. It can be sabotaged or tainted. The veterinarians are responsible for inspecting that. They teach veterinarians in other countries. My friend Nicole did a lot of this in Iraq, basically teaching them to sustain their economy. They just don't have very good education, don't really know what they're doing, don't have good training. So she helped to teach their veterinarians so that they could care for their food animals over there. They also help transporting the human casualties. They don't really want the veterinarians working on the human casualties, but they do help transport. So here she is caring for some of those working dogs. This guy's about to go in this machine and get a CAT scan or an MRI. I think it's an MRI machine. This guy's just a working dog and needs his physical exam and vaccinations. She's doing that. There's another one. This poor dog, he's a bomb-sniffing Labrador. He got babesia in Iraq. It's a tick-borne disease. And here they are loading him up on a chopper to get him better medical care in Baghdad. He had to go to a bigger hospital. Here they are educating the Iraqi veterinarians. Here's a picture of a tiger from the Baghdad Zoo. This donkey was presented by some locals. They were worried about sabotage, that somebody had fed the donkey an explosive and it was going to blow up. I think they x-rayed it, that no explosives were found, but that was a pretty interesting case for her. Here are some pictures from food inspection and food testing. So physically inspecting, actually looking at the peppers, and then going out on deployment to check the food supplies in various locations, and then testing in a lab. And mass casualty training. So I was saying that they help, these are the veterinary crew. They're veterinarians and veterinary technicians, and this is just a pretend, they're just doing a drill. So this soldier is laying there and they're just learning how to transport them efficiently and properly into the helicopter so that the Army doctors can actually work on the injured personnel. This is my friend Nicole, love her to death, and she is with Major Eden, the therapy dog. Very important for the soldiers, she said. Christmas in Afghanistan looks pretty different than Christmas here, huh? Okay, so veterinary medical school, probably what you guys all want to know about. It is a 4-year degree. That is usually done after a 4-year undergraduate degree at college. You can get in before 4 years. You have to have a certain amount of prerequisites, which usually take at least 3 years to get. So most people enter with a 4-year college degree. In order to apply for vet school, you have to take the GRE, which is the Graduate Record Examination. It's kind of like your SATs, but for college students. You also have to fill out an application, which a lot of you seniors are doing right now. There is an interview process, and you have to have some experience. They want to know that you have shadowed a veterinarian, maybe worked in a shelter, things like that. They want to know that you've seen the good, the bad, the ugly, and you really know what you're getting yourself into and that you're prepared for it. Here are some students at my veterinary clinic getting some experience. This young lady is now a CSU student. She went to Cherry Creek and worked for us over the summer. She got sent home early due to COVID, and we put her to work. So she's helping hold animals. This is my daughter, Nicole, helping to weigh a cat. So she worked for me starting when COVID hit and throughout the summer, and she still works there on weekends. So there are ways of getting experience, either working at a vet hospital, volunteering, helping out at a shelter, riding along with an equine vet, things like that. Definitely start thinking about that if you're interested in veterinary medicine. Vet school, age range 21 to 54. Most people, like I said, have a 4-year degree. They're about 24 years old, but it can range a lot. This might be surprising to you. It's 84% women, 16% men. When I went to veterinary school in the late 90s, it was just hitting 50-50. It was dominated by men before that, so just kind of interesting. Don't really know why that is. GPA range 2.6 to a 4.0. So definitely doable in there. The highest degree at application, like we talked about, most of them down on the bottom is highest degree upon admission. So you can see when they applied, 80 of them had their bachelor's degree. They finished it, and most of them have a bachelor's degree upon admission. These few, no degree, these would be people who were in college and got their prerequisites done, didn't feel the need to complete the 4-year degree, applied to vet school, and got in. Class size last year at CSU vet school was 149 applicants got in out of 2,284. So it's kind of a popular career. But veterinarians don't give up easily. So these 120 applied once, these 23 twice, and 6 3 or more times. So they just kept at it. Oh yes, my veterinary nurses. I wanted to talk really quickly about them. They are super important. Can't do a thing without them. Here they all are prepping this animal for surgery. To become a certified veterinary technician, you need a 2-year degree. In this area, Colorado Mountain College up in Glenwood Springs offers that degree. Bellray Institute in Denver has that, and then Community College of Denver also offers a program like that. Their duties, they are the ones that do the dental cleanings. They are the ones that take the x-rays. They set up surgery. They monitor anesthesia. Phlebotomy, that is basically drawing blood. Catheter placement, they put a catheter in. That's what they're doing here, shaving up, putting a catheter in so we can run fluids. They run the lab work. They run fecal and urine tests. They assist us in all sorts of ways, holding animals, handing us surgical instruments. They give medications, all the injections. They are wonderful with caring and comforting patients. And they do a lot of our client contact. They may call Mrs. Smith when her animal is out of surgery and let her know everything was okay. They order our drugs and supplies, and they do some office duties, answering phones, checking patients in and out. We also have receptionists that do that as well. Hopefully this little video won't mess us up, but this is a very skilled nurse placing an IV catheter. And in it goes. And there it is.
You gave the first 4 seconds of the video. That's it.
Okay, where are you now? Can you see next slide?
Nope. And we.
Okay, let me stop sharing. And
Recording now.
okay, we are back. So, as I wrap up today, I just wanted to share a little bit with you about compassion fatigue because it is real in any career that you might choose in medicine. But I think, especially so in veterinary medicine, reasons for that, we do a lot of euthanasia, which means having to put animals to death, basically. It's a very compassionate thing to do, usually, but it can wear on you. Also, convenience euthanasia, which I just flat out won't do, but people asking you to euthanize animals for not very good reasons can certainly wear on you. Also, people ask their veterinarians for a lot of things for free a lot of times, and it's a business, and a lot of animals don't have insurance like people do in medicine, so they're asking for these things for free, and you just can't do that all the time. Your business will not survive. And then they make you feel like the bad guy, or you just feel that way. That can be very draining. The other thing is short lifespan. So you see a lot of these patients come into you as puppies with happy families, and they may only live 10 to 14 years, and then they pass away, or you euthanize them. And that happens day in and day out, over and over and over again. So you're getting a lot of these um, sad cases, difficult situations, money problems where people just can't afford to do what they would like to do with their pets, and it can be really draining. So you really have to, take care of yourself and forgive yourself, and just really keep a very positive attitude, good frame of mind, get help when you need it, and just kind of realize that this career can be very mentally and physically demanding. It's not just playing with puppies and kittens all day like a lot of people think, but it is truly a very rewarding and very interesting career. And sometimes we do get to just play with puppies and kittens. So I wanted to share with you a bunch of these cute little guys. So let's just enjoy these puppies and kittens. Oh, they're so cute.
Oh, we didn't switch screens.
Oh no. Ah, why would that be? I wonder. Okay, so you paused me.
I'm pausing you now. Now.
Okay, so like I said, it's not all just puppies and kittens. It's a pretty difficult, demanding profession, but sometimes it is just puppies and kittens. And more puppies.
Didn't go. It didn't go.
Oh, but they're so cute.
I understand. Lots and lots and lots of puppies and kittens. Oh,
Okay, you're seeing them now.
yes.
How come when you do it, it works, and when I do it, it doesn't work? Okay, so stay in here and advance for me. Can you?
Go back to the Basset Hound puppy.
Or the first puppy. Okay, so he's using arrows. Should I do that? Should I use arrows instead of this thing?
Sure.
Okay, maybe that's it. Okay, don't go anywhere. Okay, so let's start. Okay, let me just try it one more time. Does that work?
Yes. Yes.
Okay.
Oh.
And then back. Okay, so should we start here again?
Puppies and kittens, yeah.
Okay.
You're good. Go ahead.
Okay, so as we were saying, it's not all just puppies and kittens, but sometimes it is puppies and kittens. So I have lots of pictures. These are mostly COVID puppies. A lot of people adopted and got animals during COVID. So here's my COVID puppies.
I want to take them all home, please.
I know, aren't they so cute?
Oh.
Oh, so cute. And then this is a whole litter of pugs that came in. There. So that is the end of my presentation COVID style. So I hope you guys enjoyed. Sorry about technical difficulties. And if you have any questions, please let Mr. Stirrup know, and he will definitely share those with me, and I'll get back to you.
Absolutely. Well, thank you so much for this today.
Thank you.
Stop recording and